Hi, this morning we're here at Umina Podiatry with Jolene, and she's really interested in skin conditions, and she's got this special device which is called
a dermatoscope.
A dermatoscope. Now, this is something that we use to magnify and look really closely at skin lesions, things like moles and questionable lesions that we think may be skin cancers.
It could be skin cancers,
rashes.
or are we sure that it's a mole? Is it a blood blister?
That's right. So how do you use it? You have to use some
we use a little bit of a gel and then we put it on, which is just a water-based gel.
Yeah.
And then we just roll it on so you don't get any bubbles.
Yeah.
And then just have a look through the scope and
so you've
see
got
what we see.
You put it on the skin, like on your hand like this.
Yep.
And press the button, and there's a light, a strong light that comes on, and a big lens that magnifies. You can't really see. Well, maybe you can see. Look at that! I've got a hairy hand. That's great. So you've done some more study, haven't you, since you graduated?
Yeah, I've done some little studies.
To learn about how to use this type of device. And so does this also take photographs?
No, it's got an attachment that I can put onto my phone.
Okay.
So then I can take a photo, and it's really handy so you can compare things later on to see if it has changed over time.
Excellent. So you can attach those photos to a patient's records.
That's right.
And then review them in 6 months' time and see if there's any changes.
Yep.
Brilliant, brilliant. Is there anything that you've picked up with this in the last few months?
Look, I've had a couple of questionable ones, and look, the last thing I'm going to do is diagnose someone with a melanoma, but I can certainly sort of get an idea if it's looking a bit chaotic and take a photo and flag it with their GP and get someone who specialises in that area to really look at it.
So what we do, we look at feet all day, and if we find something we don't like the look of, we send it back to the GP, and they can refer you to
either dermatologist or
skin clinic.
Someone who can more detailed look at it.
Brilliant, brilliant. All right, so if you've got any funny looking lumps or bumps on your feet, lesions, moles, or even things you haven't spotted, because we see things a lot more closely than you, we can have a look at them with the dermatoscope, and we can refer you back to your GP or your skin specialist if necessary. This is a brilliant addition to what we can do to help you avoid more serious skin problems. Ask about the dermatoscope if you're worried about any lumps or bumps or lesions on your feet next time you're here.